All right, so let's look at elbow pain. So, of course, first we put on a lubricant. I'm just, as I said, you're just using a moisturizer. You can use your oils, whatever you like. But that's your first step. You can actually do gua sha with a layer of clothing on without a lubricant, but this is how you're going to do it. So, my trusty kitchen spatula, and you can see the first thing you're doing is scanning the muscles. So I'm going up the muscle to find those grittiness. And then I'll go back down. You can see the angle I've got the spatula there. It's just it's at a slight sort of 30 to 45 degree angle as you go up there. And so I'm feeling for where it's grainy or gritty. And then we're going to break it up. And this is the way you're going to work with your gua sha. Now we're starting to deal with problems. So we're dealing with elbow pain and tennis elbow, which is lateral epicondylitis. So we're just working. So I found, you see that, I've found going upwards. So I'm going to go upwards and then downwards and see what areas are grainier. Those bumps in the road as I talked about. So as we work along there, and then I've found some grittiness, and now I use the other end. So we're using a more direct area to work that real grittiness there. So we're breaking up adhesions now. Okay, so that's what we're doing. I'm just going, you can see I'm going in all different directions. I've found the grittiness, and now I'll go in all directions to find where it's grittier, if you like. So that would tell you where there's more restrictions as we break up this scar tissue between these muscles here. So to go back, what I'm doing is sort of using the broad edge of the handle. That's the epicondyle there, I'm just showing you. This is where people have pain with tennis elbow. Okay, got out a spoon. Give that a go. Because it's nice pointed end. And you can do some what's called cross fiber friction across it. This will be tender on people who've got problems. So you're going to go easy on this. And we're just going to work across that and work down that muscle to really help the fascia and between the muscles here. And it's such a great technique. So I'm just using the other side of the spoon. And the reason as I've said to you before, you can get your own gua sha tools if you're into it or if you've got them. But I really want to make this accessible. As I say, you just need to go to your kitchen for people to get started. And if you're really into it, by all means, buy your own gua sha tools. And I say that the nice stainless steel ones that I showed you at the start are really great. I just changed over to use the metal lid. I'm just showing you that you can really use so many different things, just like the Chinese did. They used old coins, metal lids, and I can feel a lot through this metal lid. I'm showing you, see that? If you look closely, you'll see it actually bouncing. There's real grainy scar tissue in there, probably from 25 plus years of massage, I guess. So I go up and see if there are bumps in the road, and then I go back down along the muscle. When I find a spot, then I'll go in all different directions to find where it's bumpier, and then break up that scar tissue. So I found, this is my elbow and forearm, and I did find a lot of adhesions through my forearms, again, from years and years of doing pressure point work and massage, that sort of thing. So just like massage, what I did was I used the broad spoon to get a look. Now, you could use both hands on the spoon if you're treating someone else. I really want to focus on doing self-treatment in this course. So you see a little bit of redness coming up there with the scar tissue, the adhesions getting broken up. Just a little bit there. And just work above the elbow there as well. What was I saying? Oh yeah, so just like massage, you do broad strokes before you start to do other sort of more, now at this point here, other more digital pressure and that sort of stuff. Now this is large intestine 11. It's the end of the crease. When you bend your elbow, it's the end of the crease. This is a great point for tennis elbow and elbow pain. We'd put acupuncture pins in this. You're doing gua sha with what am I doing? Back end of a spoon. And this is large intestine 4. Contraindicated. If you're pregnant, don't use this point. But you see that's at the end of that crease, right in there against that forefinger. I have in your resources large intestine 4. So you can see that. And we're just working that with another fabulous acupoint. And then just broad strokes again, just seeing what we've got. You see a little bit of redness I've got there. That's fine. That's what I was just showing you there. So for forearm pain, elbow pain, tennis elbow, these sorts of things, this is a great treatment for you to do twice a week on yourself or on your clients.